Hey everybody, Dr. Becca Hayes here at Gate Chiropractic Center, and I am here today with the lovely Sarah, one of my patients who is just recently postpartum, and she's going to share a little bit about her experience just seeing us here at Golden Gate while she was pregnant and also in this new postpartum phase.
Yeah, so like Dr. Becca said, we just had a baby like 2 weeks ago, and I've been seeing you before I was pregnant. You actually were really instrumental in helping me like adjust my body to be able to even get pregnant. And then I don't know what I would have done if we didn't have chiropractic care like the whole pregnancy until like after as well.
Yeah. Well, you had a really busy life. You were chasing around 2 toddlers, preteen, and now you have the new baby.
Yes.
So the stresses on the body were pretty high, right?
Yes.
And I remember when we first started, when you were pregnant, you were dealing with a lot of like lower back pain, some like radiation stuff, and it was really good to be able to kind of set that right on your path, right?
Yeah, and I feel like all the hip adjustment stuff too was like, felt like I went into birth being like, okay, everything's like formatted the correct way. So like I know what I can do and like it feels good. Yeah. And then
do you want to talk a little bit about your birth experience recently as compared to maybe your previous?
Sure. Yeah, I feel like my birth experience with especially being well like adjusted and formatted and everything was really simple, really easy, short and sweet, and the recovery's been amazing. So yeah.
Cool.
Yeah.
So today we're going to dive into a little bit of what a postpartum adjustment looks like. It's still a little bit different considering that Sarah just gave birth 2 weeks ago. You can hear Charlie right now. And so it will look a little bit different than what most people have typically seen during a chiropractic adjustment, but I think it's important to note that with how much the body changes, we get to do things a little bit differently based on exactly what somebody needs.
Yeah.
Things that is important about postpartum care and pregnancy care is making sure that we have enough comfortable space for mom's belly to be in, especially, in pregnancy. We don't want the baby to be squished when you're laying face down, and in postpartum, as everything is still kind of shrinking, it's nice to have a little bit of cushion. So we have these lovely pregnancy pillows that have this little divot in here that make just things a little bit more comfortable. All right, Sarah, go ahead and go face down, please. So while most of pregnancy care is focused on aligning the lower half and prepping for birth so that the hips are in the center, the sacrum is mobile and allows for opening during that birth process, we still want to obviously check in on all of those things here, but most of my moms in the postpartum period are mostly dealing with a lot of upper body tension from bending over breastfeeding, getting nap trapped in funky positions, all of those kinds of things. So we're also going to check in with Sarah's upper body as well as her lower body today. Now, one of the last movements that typically comes back for my moms is the twisting motion through the lower back. They will typically tell you until 6 weeks after birth they don't want you like hinging or squatting or any of those kinds of things, but most people are going to be tending to do those motions anyway to pick baby up out of crib or to grab a stroller or even get down and get into the car seat. Like all of those hinging and squatting motions are a pretty normal part of the postpartum period. So although they may not be our heaviest hinge or our squat, we still want to make sure that all of our lower body musculature is moving successfully. So the biggest thing that I'm noticing here for Sarah today is a little bit of tension within her tailbone, and she can probably even feel that as I press through there. She says, And so like I said, that twisting motion is typically the last thing to come back and requires the most core stability. So once we've just given birth, we're not really fully in tune with our core anymore. So our goal of this adjustment is going to be gentle, easy motion, not from a twisting maneuver. So we're gonna go from a more neutral place. So I'll be using the table here. So it's gonna pop underneath Sarah like that, and then it will fall and allow us to just kind of gently rock her tailbone back to the center. And like I said, that pillow provides a good amount of cushion so that this doesn't feel like too much pressure through that front or anterior portion of her body. Okay. Nice. So you can see here still a little bit of restriction on that right side. That heel is not going quite as far to her lower body, so that means we still got a little bit of work to do through here. And then I'm also just going to release some of these muscles of the lower back because, again, they're kind of relearning how to turn on and hinge and squat after our center of gravity is back to what it was pre-pregnancy. So, Sarah, if there's too much pressure, you just let me know. That's okay there?
Yeah.
Cool. Good. And then we'll recheck here. Much more even now. There we go. That's what we wanted. Awesome. Then, like I said, for most of my postpartum moms, while the lower back does still tend to have some pinchy or tough spots, the main spot that most people tend to feel is this upper back situation from breastfeeding, because most people are in this kind of curled forward position. So we're actually going to flip Sarah over face up to allow for some more extension. So go ahead and flip over face up for me, Sarah. Doing okay there, Sarah? Mm-hmm. That feels good, right?
Mm-hmm. Cool. That was so good.
She literally just finished breastfeeding right before this, so
Yep.
there was definitely some extra crunchies in there. Cool. Then the other thing I'm going to work on that tends to be pretty tight is kind of where that neck junction meets that upper back, because again, so much of our time is spent looking down, helping baby find their latch and find more comfortable position. So that's the other spot that we are going to go through as well. Right. Okay. Nice. And the last thing we're going to do is address kind of the front half of the pelvic bowl. So oftentimes we talk a lot about this back half, this tailbone portion, or these hips. But the other part that I think tends to get missed a lot is the front half of the pelvic bowl, because as you are giving birth and this pelvis will open, you can see the shift that still occurs in the front half of this pelvis at the pubic symphysis. And so it's an area that tends to get a lot of shear pressure or shear pain. A lot of my moms during pregnancy deal with pubic symphysis dysfunction or really intense pubic bone pain or round ligament pain. And so we just want to make sure, again, after kind of the intense thing that is birth with opening of the pelvis, that we address this front half as well. Good. So for this adjustment, I typically use a tool just because it's a little bit more comfortable that way. So this is called an activator. What it does is it sends a vibratory impulse into a place. So it's a way we can move something without it being as maybe intense as a manual adjustment. And this is also what I use for my patients who don't love pops and clicks. Last one. Good. I think Charlie's hungry again. Ace is on binky duty.
Great.
Not into the binky?
No.
Try harder. No, I'm just kidding. It was a hard no? Yeah.
If you're comfortable, I'm okay with you also picking her up. You can say it. You can say no too.
The reason Carolyn's baby is getting, what's it called?
Therapy, is that what you said? Yeah. Every time Ace picks up Carolyn's baby, they cry.
Oh, no.
He's not the chosen one. Cool. And then the last thing I want to work on for Sarah is just some tension in this hip flexor on this side. So again, the hip flexors can tend to be a tough spot. So I'm just going to do some work through here. That's okay pressure, Sarah? Mm-hmm. Cool. Typically, because most of our birth positions are kind of the legs in a flexed position in that deeper squat, these muscles can be a little tight after birth. Good job, Ace. Not the reason Charlie will be in therapy.
She has plenty of other reasons.
Good. All right, Sarah, you're all good to go. You could go ahead and I will help you up. Go ahead and go arms here. Similar, we always help mom up from this position because core is not quite back in action yet. You're very welcome.